Hospitals are running low on IVs after Hurricane Helene damaged one of the country's largest production facilities, Baxter International, which supplies 60% of the nation's IV fluids, had to close after floodwaters damaged its North Carolina site. The National News Desk, Jeff Harris, joins us. Jeff, reports indicate that 86% of health providers are now experiencing an IV fluid shortage. Is there a backup plan?
So what we know right now, and as of tonight, Didi, is that federal health officials have now approved the import of certain IV fluids from overseas. So some help is on the way right now. But in the meantime, I'm told U.S. hospitals are starting to ration supplies.
Joshua Denson, an intensive care physician at East Jefferson General Hospital with Tulane University, tells us he's experiencing this IV fluid shortage firsthand.
It's being felt definitely throughout the hospital, and it definitely is on the back of everybody's minds.
Denson says his department has to use IVs, but in other departments, it's being communicated to try and ration resources.
When there's a 50-50 call, if you need to use some IV fluids, to maybe not use those in certain circumstances.
Arjun Venkatesh, a professor of emergency medicine at Yale, tells us this shortage is a lot more widespread than many think. It's affecting saline and fluids for dialysis and nutrition.
Many people get nutrition via an IV if they've got a cancer of the mouth or for some reason have to be fed via an IV because they can't swallow food.
Like most hospitals and emergency departments across the country, Venkatesh says they're taking proactive steps to try and conserve as much IV fluid as possible.
Encouraging people to drink fluids orally instead of intravenous, things like that are already starting to work. Is it going to be enough to weather the whole storm? I think that remains to be seen.
A question Denson also once answered, but for the time being, outside of the ICU, they're doing everything they can to get by.
We don't have much luxury to withhold certain things and wait and see, but other places in the hospital we do, and we're doing that.
After a brief pause, Baxter did resume distribution of supplies, but with a significant restriction on the amount that can be offered. Right now, they're at about 60% of typical order volume. Reporting for the National News Desk, I'm Jeff Harris.